Good afternoon. Thank you for joining us today. My name is Dr. Scott Harris. I'm the Acting State Health Officer with the Alabama Department of Public Health. I'm joined here today by Mr. Jeff Rains, who's the CEO of Baptist East Hospital in Montgomery and representing the Alabama Hospital Association, and also by Colonel Brian Hastings, who's the Alabama Emergency Management Agency Director. Thank you both for being with me today, and thanks to all of you for joining us. We're having this press conference today to talk to you about the current state of influenza in Alabama. We have a crisis situation going on with numbers of patients who've been infected with influenza. We see flu every year at this time, and this is the normal seasonal flu that we typically see. There's nothing out of the ordinary in terms of the type of influenza that we're seeing, but we're seeing very large numbers, and that's particularly been true for the past 2 to 3 weeks. We have many more people presenting to our hospital emergency departments who are seeking treatment for flu, which is causing a situation for those hospitals who are not able to necessarily handle everybody in a timely way. Hospitals themselves have issues with their own staff members becoming sick, and so all of this led yesterday to Governor Kay Ivey issuing a proclamation that declared a public health emergency in the state. The purpose of a public health emergency declaration by the governor is really twofold. One is simply to raise the level of awareness among the public about what the situation is. The governor's proclamation makes people sit up and take notice and understand what type of situation is going on and how important it is. It also has a practical effect of making it a little bit easier for hospitals to use flexibility in how they deal with certain types of problems. For example, when they are overrun with patients and have more patients than they normally would have capacity to handle. One of the issues that comes up with hospitals is that sometimes when they have many more patients than normal or perhaps lower numbers of staff members than normal, then they can activate what they call their emergency operation plan, and they can implement what's known as an altered standard of care. That is, they tend to treat patients in a somewhat different way than they might be if there were normal numbers of patients and normal staffing ratios. So, for example, many times patients who have influenza or other illnesses may need to receive IV fluids, but during these altered standards of care, there may be some cases when medical providers decide that oral hydration or oral fluids would suffice as well. So that's an example of altered standards of care, and so the governor's proclamation makes that easier and gives the hospital more flexibility in making those decisions. We know now that among the 8 public health districts in the state of Alabama, at least 7 of those have hospital capacities that are at 10% or less. That is, more than 90% of hospital beds are filled within those public health districts. That actually applies to about 30 of Alabama's 67 counties, and there are several counties that are over capacity. That is, they have more patients admitted to the hospital than there are beds in those hospitals. They have patients who are waiting for rooms. So we want to come to you at this time as part of this press conference and just remind people exactly what the situation is and try to encourage you to stay home if possible and to avoid the use of an emergency department unless it's truly an emergency. Remember, influenza is a respiratory illness. People typically have high fever and chills, cough, body aches. Those symptoms may last for several days. We generally consider people to be infectious for something like 5 to 7 days, so even after they begin getting well, they typically want to stay home from work or stay home from school somewhere between 5 to 7 days. Children can sometimes be contagious even longer, so if you have children who have been sick, please consider keeping those kids at home. If you have symptoms yourself, we would ask you to stay home. Please avoid public places. Don't go to work, don't go to church, don't go shopping, but stay home until your symptoms resolve, until you've had enough time to no longer be considered infectious. If you need to seek emergency medical care, then by all means you should do that. But if your symptoms are not severe, then we would ask you, first of all, to try to contact your doctor by telephone and see if you can have your issues managed that way. Many physicians are treating patients after triaging them by telephone and providing antiviral medication, and it may not be necessary, for example, to go have a flu test done to make a diagnosis. The flu is so widespread that we certainly believe people are likely to have the flu if they have most of these suggestive symptoms. There are many people that have insurance that provides for telemedicine consultation or teledoc consultation, where you can actually talk to a practitioner face-to-face using your computer or your cell phone. And if your insurance provides that opportunity to you, then we would encourage you to try to do that first of all before seeking care at the emergency department. Remember that this coming Monday is a holiday, is a state holiday. And so there may be certain offices, medical offices or clinics or doctors' offices that are closed. So please remember that. We sent out a Health Alert Network message yesterday to all the providers in the state and encourage them to consider remaining open on this Monday holiday as another way of taking care of the number of sick people and helping to ease the burden on our state emergency departments. So just a few reminders. The most important thing that I can remind you is please get vaccinated if you have not done that. It is not too late to get the flu shot. You may not have full effectiveness from the shot for up to a couple of weeks, but the sooner you start, the sooner you get protected. We know that the flu vaccine is not perfect. It doesn't protect every person from every strain of flu, but it's still the most effective thing that you can do to prevent yourself from getting an infection. Normal, healthy adults who get influenza may do fine, but you have to remember there are a lot of vulnerable people out there who may not do well if they become infected with influenza. So elderly people, people age 65 and older, young children, particularly under age 4, or pregnant women are three groups that tend to have particularly bad outcomes if they become infected with influenza. So if you have those people in your family or among your circle of friends, then please get a flu shot for their benefit. Please protect yourself so that you don't infect those other people that you care about. We would ask employers and schools maybe to consider waiving their policies for sick notices, for sick slips. If a person has been out with a sickness, then sometimes they feel like they need to present to an emergency department or a clinic simply for the purpose of getting a slip to return to school or return to work. And so that just adds to the number of people who are seeking care. We would ask employers and schools to consider waiving that if possible. Those are all the comments that I have at this time. I'm sorry, one final thing I meant to mention. The ADPH is planning to open flu clinics in our county health departments starting next week. We will not necessarily have that available in every county. We're still counting up the doses that we have, but we know in every public health district we will have at least some of those county health departments that will be open and providing flu clinics, and more information will follow on that as soon as we have that available for you. At this time, I'm going to turn the podium over to Mr. Jeff Rains, who's representing the Alabama Hospital Association.
Thank you very much. Appreciate the opportunity to be here, and really my comments echo exactly what's already been said today. This is certainly a significant time in our state, across the country, in many areas where the growth of flu and the flu illness has really ramped up in a proportionate way that is very significant. We're obviously in the flu season, but when you compare the volume of flu that we are seeing across our state in this time period compared to last year, there's significant difference. So this is an important time. I think that the comments that were made about appropriate care and where to seek that care is important, because obviously, speaking for all hospitals around the state, our emergency departments are primarily there to treat emergencies. And with the volume of patients that are coming into our emergency departments for flu-like symptoms that may not carry other conditions, creates real capacity issues for our facilities. Hospitals are working diligently through their care plans and through their capacity crisis management plans, if you will, to manage those capacity problems in a variety of different ways. But obviously that creates care issues in our facilities across the state, just because, again, the volume of patients is more than the hospitals can meet in certain circumstances. So I think, has been said earlier, seeking care in the appropriate place, your primary care physician, your urgent care facility, is probably a better first resort than defaulting to the emergency department. And I think I say that at the same time in saying, obviously our doors are open to treat those that are sick. Obviously those that are 65 years and older or more susceptible to other medical conditions following a flu illness. So certainly if you're exhibiting those types of symptoms, please come to your emergency department. The other thing, I think the comment about the flu clinics that will be opened across the state by the Alabama Department of Public Health is a tremendous help to our state hospitals, It'll be a tremendous help to the people of Alabama, and certainly welcomed as we work through this situation. So I think that's really all that I had to say. I know we're going to have some questions. Thank you very much. There was a comment, and I'm glad you mentioned that. I do want to mention about visitation policies. You are seeing, and will be seeing, I think, across the state, most, if not all, hospitals really working on their visitation policies. Many hospitals are limiting visitors to only one visitor at a time. Many hospitals are limiting visitation in some respects, no visitors that are younger ages, some 12 or 14 years old. And this is really for protection in both ways. We obviously want to protect the public, the visitors who come into the hospital, but more importantly, we want to protect the patients that are in the hospital that are already at a susceptible state, and they don't need to have the flu virus brought to them. So please understand that this is not to try to be restrictive. This is just an out-of-the-ordinary situation that is really important for hospitals to manage the spread of the flu and obviously protect our patients and the visitors that come to our facilities. Thank you.
As I mentioned earlier, I do want to thank the Alabama Emergency Management Agency and Brian Hastings. Thank you for being with us. We appreciate your support, and we appreciate the chance to work with our state partners in trying to work on this situation. If there are questions, we'll be glad to take them at this time.
Have there been any deaths attributed to flu yet in the state of Alabama that's been reported that you're aware of?
The question had to do with deaths attributed to influenza. We do not have any reports of that at this time. We have not. We do not typically track adult deaths due to influenza, although we have now just asked hospitals and physicians to report that to us. We're going to make that a reportable condition for the time being until we see what the condition is. We've always tracked pediatric influenza deaths, but not adult deaths. But we'll be doing that for the remainder of this flu season at least.
Any concern about the amount of Tamiflu that's being used? Because that's
So the question has to do with the amount of Tamiflu that's being used or that's available. Tamiflu, as you know, is an antiviral medication. It's not a cure for influenza, but it does improve symptoms if it's given within the first 48 hours or so of the onset of illness. At this time, we've not heard any significant shortages of Tamiflu that seems to be available. I would say that just about every flu season, we hear some stories that maybe this drugstore is out or this wholesaler is a little bit short, but really nothing significant. And right now, all the Tamiflu that needs to be dispensed is being dispensed as far as we know. Does anybody have anything else today? Okay, thank you again for joining us. One final thing, just remember, the best way to prevent influenza is to get a vaccine. Be sure to wash your hands, particularly if you're sick yourself. Remember good cough etiquette and sneeze etiquette. Stay safe and stay healthy, and thank you for joining us.